The uterus is a hollow muscular organ where a zygote will implant and a fetus will grow. There are two types of uterine cancer. The first one is endometrium cancer, which is located in the lining of the uterus. The second is uterine sarcoma, which is less common than endometrium cancer, and this type of cancer forms in the muscle and tissue that support the uterus. There are many risk factors to developing uterine cancer, such as women who are older than 50, obesity. If you are trying to do a hormone replacement, taking estrogen alone can increase your risk of uterine cancer. However, if you take estrogen and progesterone at the same time, you decrease that risk. Close family members with uterine, colon, or ovarian cancer increase your risk of uterine cancer. Early menstruation, late menopause. If you are taking tamoxifen, which is a drug for breast cancer, you can increase the risk for both endometrial cancer and uterine sarcoma. And radiation therapy to the pelvis area can increase your risk of a uterine sarcoma. Although there are many risk factors for uterine cancer, there are also things that we can do to help prevent it, such as women can take contraceptives that combine estrogen and progesterone. If you are pregnant or breastfeeding, you have decreased your chances of developing uterine cancer. We have all heard we need to eat fruits and vegetables to stay healthy and cut back on all the bad fats. So a diet that is low in saturated fat but high in fruits and vegetables does decrease your risk of developing uterine cancer and also other health issues. The signs and symptoms for uterine cancer are bleeding or discharge that is not associated with menstruation, difficult or painful urination, pain during sexual intercourse, and pain in the pelvic area. In general, we know how our body works, and so we know when something doesn't feel right. So if you do have this type of feeling that just something isn't right, it's very important that you go to the doctors to get it checked out, so that way you can see what's going on sooner rather than later. An endometrial biopsy is when you remove tissue from the endometrium by inserting a thin, flexible tube through the cervix into the uterus. The tube then takes off a bit of tissue from the endometrium. Dilation and curettage is a procedure to remove samples of tissue from the inner lining of the uterus. So the cervix is dilated and a curette is inserted into the uterus to remove tissue. With both these two tests, you are looking under a microscope to see any signs of cancer. A physical exam and history is great because you're able to actually talk to the patient and physically see any signs and get any reaction from them and ask them questions about family history or anything they've been feeling lately. A transvaginal ultrasound exam is a procedure where you're able to examine the vagina, the uterus, fallopian tubes, and bladder. So an ultrasound transducer is inserted into the vagina and used to bounce high energy sound waves off the internal tissues of the organs and is able to make echoes. The echoes then form a sonogram, which is a picture of the body's tissues, and then the doctor is able to look to see if they see any tumors through the sonogram. There are 4 stages of cancer, and within each stage, it's broken down even further. So stage 1, the uterine cancer is found just in the uterus, but stage 1A is when the cancer is in the endometrium only, or less than halfway through the myometrium. Stage 1B is when cancer has spread halfway or more into the myometrium. Stage 2 cancer has spread into the connective tissue of the cervix, but has not spread outside the uterus. Stage 3 is when the cancer has spread beyond the uterus and the cervix, but has not spread beyond the pelvis. So stage 3A is when the cancer has spread to the outer layer of the uterus and to the fallopian tubes, ovaries, and ligaments of the uterus. Stage 3B is when the cancer has spread to the vagina and or to the perimetrium. And then stage 3C is when the cancer has spread to the lymph nodes in the pelvis and or around the aorta, which is the largest artery in the body, which also carries blood away from the heart. Stage 4 is when the cancer has spread beyond the pelvis. Stage 4A, cancer has spread to the bladder and or the bowel wall. Stage 4B, the cancer has spread to other parts of the body beyond the pelvis, including the abdomen and/or lymph nodes in the groin. There are many different treatment options for someone who has uterine cancer. The first being surgery, which is the most common form of endometrium cancer. A total hysterectomy is a surgery where you remove the uterus, including the cervix. A bilateral salpingo-oophorectomy is a surgery to remove both ovaries and both fallopian tubes. Radical hysterectomy is a surgery to remove the uterus, cervix, and part of the vagina. The ovaries, fallopian tubes, or nearby lymph nodes may also be removed. Radiation therapy is a common cancer treatment that uses high-energy X-rays or other types of radiation to kill cancer cells and keep them from growing. Chemotherapy is a cancer treatment that uses drugs to stop the growth of cancer cells, either by killing the cells or by stopping the cells from dividing furthermore. Hormone therapy is a cancer treatment that removes hormones or blocks their action and stops cancer cells from growing. And lastly, biologic therapy, which is a treatment that uses the patient's immune system to fight cancer. The CDC looked at about 100,000 women between the years of 1999 and 2012 to see how many people got uterine cancer each year, and also looked at the death rate. In 2012, it was reported that white women had the highest rate of developing uterine cancer, and they were then followed by African Americans, Hispanics, Asian or Pacific Islander, and then American Indian, Alaska Native women. As far as death rates, as of 2012, Black women were more likely to die of uterine cancer more than any other group. They were then followed by white people, Hispanics, Asian/Pacific Islander, and American Indian, Alaska Native American. Thank you for watching my video, and I hope you were able to learn more about uterine cancer.